Hello, everyone. It's another Wednesday with your fertility specialist. And yes, it's a game changer Wednesday because today we have amazing nurses from house hospitals. So, dear viewers, a lot is on ground for you today, for you to get. You can't afford to miss this right now. Call up someone, share this link with someone. If you need to send data to someone, please do that right away because there's just a lot for you to take home today. Like there's a lot for grabs, like they'll say. There's a lot for grabs. Okay, so yeah, on behalf of Alps Hospitals, we love to say a very big thank you to our dear viewers. Thank you for liking our posts, for sharing. Thank you for always staying glued to your screen. You guys are the best and we do not take it for granted. Thank you so much. Yeah, so it's Nurses Week. Happy International Nurses Week, I must say. Oh, yeah. So, every nurse out there, well done for your good work. We see your impact every day in the health facility, in the health system, and um, the need for nurses cannot just be overemphasized. You all a happy International Nurses Week. And yes, I must say I've not seen a hospital or rejoice and nurse lovely. Do you agree with you?
Actually, I agree with you too.
So to also hospital, I must say thank you for celebrating your nurses. Yeah, you guys are really doing well. It shows you appreciate them a lot, and
Mm.
it's extended to every nurse out there. So, like I did say that we have two beautiful nurses on set. I'm sure you can agree with what you're seeing from the screen. Oh yeah. So we have to my left hand side, yes, just beside me, we have Nurse Rejoice. She's also a registered nurse. It's good to have you, Nurse Rejoice.
Thank
Thank you.
you. Thank you very much. It feels good to be here.
Yeah.
Uh,
And just beside Nurse Rejoice, she's also a registered nurse and she's also a fertility nurse. That's more like saying she's an IVF nurse as well. It's good to have you with us, Nurse Loveling.
Thank you so much. It's my privilege to be here.
Mm. Oh, so just get ready to enjoy the show because I'm sure you all want to enjoy the show. Want your comments, your opinion in the comment section, and would be very, very glad to entertain all your questions and attend to them appropriately. Okay, yes. So, Rejoice and us lovely one. Okay, so now for the sake of someone watching, I noticed over time that when you see a quack and should also let the public know who a nurse is and what nursing is all about because it's really challenging sometimes when you see a lot of facilities that have some quacks that they call nurses, and then sometimes people address these people as nurses and then it makes them give a general wrong overview about nurses, whereas those people are not even certified to be called a nurse or they are not certified to be called nurses.
yeah.
So just tell us a little about who a nurse is and what this nursing is all about.
Okay, I will say a nurse who have undergone training in an approved institution
Okay.
and has been licensed by the Nursing and Midwifery Council to
Oh wow.
practice nurses to practice nursing.
Mm.
So now, for you to distinguish between an auxiliary nurse, any other person in the healthcare system, you have to understand that the person standing before you is a nurse when she have the license to practice as a
A
nurse.
nurse.
Yes.
So dear viewers, that's the take home. The person must be certified by the Nursing and Midwifery Council of, is in Nigeria now
Yes,
or okay.
Council of Nigeria. Yes,
So you
because we are
see,
in Nigeria.
oh yeah.
Yes.
So for you to practice as a nurse in Nigeria, for instance, the person has to be certified by them. So that's not certified by them, less of your experience, you are still a quack, or they call them auxiliary.
Yes, we
You are
are.
still
Yeah.
okay. Yeah. So what's this nursing really about? Because people just feel the nurse should always sit with them 247 and be with them by the bedside. Like, okay, what's the little how what's the nursing about? Because you're a nurse, then what you do is nursing. So what's
Yes.
this nursing about?
So I would say nursing in general should be caring.
Okay.
It's encompassing in caring.
Okay.
It's a profession that is guided by ethics and etiquettes. So
Okay.
basically, yeah, when you show care to a person, when you're empathetic, and then you
Mm.
learn to be patient with
Mm.
people, so
Mm.
it makes you carry out your nursing activities. So nursing basically is love and care for me.
Mm.
And again, as a nurse, you give care,
Mm.
not just to the physical being,
Yeah.
you give a holistic care.
Mm.
Emotionally, you give care. Physically, you give care. Mentally, you give care. So this alone is the act. It's the act of caring. So nursing encompasses of both science and it's an act. So giving out care is an act. And the care we give is scientifically
Mm.
related.
That's
So
oh, so
basically,
that's the word for me, scientific, because I could just be a patient relative. I'm also caring,
yeah,
So
Yeah.
now a nurse would care for you in a professional way. So yes, you can be a patient relative and you think things you are doing and you feel like you can do what in, but then let a nurse, there's a difference between you and a nurse. So they are just not complete. The fact you are giving care to someone who a nurse, she has said it, and they've said it as Nurse Regis has also said it, professional manner, in an empathic manner, in the way you do it. So, dear viewers, I know you are learning a lot because I think that the society has, and should I say, an exaggerated notion about the nurse, or I would say that some, in a way, sometimes they have a misleading information about the nurse, and
yes.
then they feel like what the nurse is really doing, I can do it, but it's beyond that. I mean, somebody will not just go to school to be a nurse and you feel what the person is doing, person wasted her time, and then you feel you can do
You can do
better. If
better.
you do better, please go and get the certificate and
I
let
get
how
license for it
easy
actually.
how easy it is,
Yeah.
Yeah.
oh, so yeah, it's yeah, so this is a knowledge I've also gotten from right now. Yes, care in a professional manner, in a scientifically proven
Proven
manner
manner.
that also adds to your baby. So yeah, while you were talking yourself, when you talked about the emotional need, I actually just,
Mm.
so now for instance, if you have, yes, you're a fine nurse and then you have a patient now that seems to be tripping for you. And now since you care for emotional needs as well, what would be your attitude towards that patient?
Well, for every profession, we have ethics guide the profession.
Mm.
In as much as I am a nurse and I'm giving out care to patient, there's a way I should communicate to my patient, even when I seems that this patient is not doing what is right or it's liking me, all sort of things. There's a way I should communicate to this patient so that the patient will understand.
This is against your
This
health.
is against my nursing plan. Least the patient
At
should be
that point
able
of
to
care.
make should be able to understand with me.
Mm. Okay, so yes, well, I just asked that because it's a small word that you never know who. At that point when the patient is sick and in the hospital, the patient cannot be professional to love to you in the world, because at that point he's also not stable, so you
Yes.
Actually.
cannot use that to join. Yeah, so know that you just have to professionally. And well, that's just by the way. Well, I just that was just talking outside the box because these things happen in your
A lot they
profession. Yes, they
do.
happen in your
Yeah.
and in every profession. Because somebody can go to the bank and a banker and a customer is also cheaper for the banker.
Yeah.
So
It's
so it
So
possible.
that's
happens
where
everywhere.
professionalism comes
Comes
into
in
play.
I
exactly.
think also some mental health issues comes with vulnerability. You
Okay.
understand? I think sometimes when these patients are sick, if you look into their world, some actually lack care. There are things you could attend to a patient, and you find out that it's not really about the medications taken. Take that for having emotions to you, which is very,
True.
very common. But then you should also learn to draw the line between professionalism and then your personal life. This is where you let this person know I'm care that for you. You understand? So I think when you learn to draw the line between your personal life and
Yes.
there will be a balance
Yeah,
always.
right. So that's just the perfect answer, yeah, as well. So, well, this is just by the way. But then, however, I think you, dear viewers, should actually call up a nurse right now because, yes, this is for our dear viewers, but you could also have friends that will also learn from nurses at our hospitals that are not too to say today because there's a pool of information that you're going to draw from. So please extend this to someone else so they are able to draw from this pool as well. Okay, so now our topic why they are going to talk a lot about IVF because they are IVF nurses and so much. That's talk a lot about IVF in general. So people
Mm.
also have a more broken down because in a way nurses have a way of giving a simplified understanding or simplifying the explanation to things that makes maybe that helps them to relate more with the patients or clients they are dealing with. So they will talk a lot about IVF. Well, since we are saying IVF, maybe there might just be someone watching for the first time, and IVF is alien to this. Maybe you should tell her what IVF is.
Reproductive technology. So in IVF, this time around, the sperm and egg they fertilize outside the woman's body and then later transferred into the woman. So I think basically to simplify it, that is IVF.
So, okay, so do you have something else to add to that?
Well, to add to what you said, there is form of assist productive technology. It follows steps to yield to the point of embryo transfer. So all this process, I will be discussing them as we go on with our discussion. So IVF help women who have had infertility issues achieve pregnancy.
Okay, yeah. So, dear viewers, this is just like one of when you as your host, I get to interact with a lot of the medical personnel. And I know one of the hosts sometime back, they said they call IVF natural, but just that it's not happening inside the
Inside
woman.
the
Inside the
woman's
woman's
It's
body.
body.
done in a lab. So basically, that's so. For instance, why we talk about who just comes to meet you and okay, um,
Evaluation needs to be done
okay,
because individuals varies.
okay,
Our peculiar we have peculiarities.
mm,
So each individual needs to be treated based on his individual needs.
okay,
So a lot of people will need IVF depending on my age. So evaluating these patients give you an idea to why the patient is has been having battle with infertility. Now, people who need IVF include people with tubes, damaged tubes, open heart IVF, male infertility factor to IVF process. Some reasons a woman could walk up to you, I'm not married, but I need IVF. That is a social reason why she, for herself, needs IVF. Couples who have same sex, like a
Okay.
man to man, woman to woman. Yes,
Okay.
they will want to have a
Children.
reproductive life for themselves. So such kind of people will need IVF to be able to make this
Yeah.
possible. People with genetic pre-implantation genetic testing due to genetic influence
Yeah.
are also people's healthiest baby for themselves.
Yeah.
So they go into PGT for themselves.
So are there some other reasons that you think some people would like based on your experience in just are there some other people that you would think or you would suggest IVF for based on your experience?
I think she has basically listed almost everybody I think that needs an IVF. All right, and then okay, I think she mentioned the same-sex couples, which is not applicable in our country right now. I don't
Yeah.
think that is legal.
Oh yeah,
I
well
don't
it's
think
not
same-sex
legal, but
is
I'm
not
sure there
legal.
are people
Yeah, there
practicing
are
it.
Yes, they
people,
Yeah,
but
are.
corridor,
yeah,
corridor.
yeah, I
Yeah, there
don't
are
think it's
people.
legal. But I think it is for people like that for basically social reasons. I think people a lot are coming into the picture right now for social reasons, coming into to have IVFs and all. So I think she has explained a lot. Those with blocked fallopian tubes, yeah, those people are also eligible
Okay,
for
so what's
IVF.
so for instance, maybe someone has three girls and they've been trying to maybe
Yeah,
have a boy. Would you openly suggest IVF for them?
yeah, I would because there's sex to have one. So there is a couple wants a baby girl, this couple wants a baby. Yeah, they can do a sex selection. IVF gives room. Yes.
That's where pre-implantation genetic
Genetics.
tests
Yeah.
come into play.
Wow.
It gives room for sex selection, which is 100% guaranteed.
Wow.
Yeah.
Okay.
Yes.
Wow.
That's
Wow. So house nurses are actually scientific nursing. Like you can just imagine the way they are talking like they are medical doctors. Oh my
it comes
god.
with the field actually. When you're working with experts, you'd actually pick up a bit from
Oh,
them.
oh wow,
Yeah.
that's
Mm.
lovely. Yeah, so
Mm.
Dr. Kenneth is saying well done, ladies. Oh
Thank you,
wow.
sir. Thank you very much, sir.
Okay, so dear viewers, you guys you've seen or you've heard a lot about people that would need IVF. They've given us a very simple way for you to understand and know that if you fall into any of this category, you could need an IVF. Or maybe like Nurse Loving said, maybe like a single mother, a single
Mm.
lady does not want to get married, and maybe she has waited for so long, marriage is not forthcoming, and then children for herself, you know. And then more they've said a lot more. So for us not to just dwell on what they've said, because I know that they have a lot for us, so we will not dwell so much on that. So I know that. So it's more like based on your experience, because you are going to tell your clients and the viewers a lot about IVF that they've been straight to understand.
Yeah.
And just they've come out of the consulting room and
Mm.
they're just like, I don't understand what the doctor I don't understand what the doctor has been saying. I mean, the doctor has been saying some medical, they call it medical jargons, right?
Actually,
Oh
yeah.
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 So they call it medical jargons, and like well, like they'll call it. And then when you have your clients come around
Mm.
and then they're like, I don't understand what the doctor has been saying.
Mm.
Like everything. Can you just help me understand? He's saying that I think I need to have donor egg. I mean, I don't understand, but I see my period every 3 months, why with how to explain your IVF. There are a lot of misconceptions that I believe people have to IVF.
Yes.
They first of all they don't feel they are normal babies. They
Mm.
don't feel they are like the other babies gotten through conception. As a matter of fact, they feel IVF is not natural.
Actually.
But with the knowledge I've gotten from you, from also some of the personnel that we've had to deal with on this show, we've gotten to understand that IVF is also natural. It's just that it's assisted, but
Yes.
then it's there's nothing artificial about it because it's just the same thing that actually happens
Yeah.
in the woman, that they are mimicking what happens in the woman to make it happen outside and then put it back to her.
Yeah.
So what are some of the misconceptions based on your experience with your period of practice? What are some of the misconceptions or wrong notions that maybe some of them have expressed to you with
Yeah.
regards to IVF? I believe you've had a lot of them.
Yeah, actually, one of the basic misconceptions I've had over time is that IVF is 100%. It
Mm.
means that the moment you're going in for IVF, it is guaranteed that you're going to end up pregnant, which is not true. And then it has a level that, okay, it's not 100%, but I think with technology, we're gradually getting to an extent where we might get to that. But for now, it is not 100%. And then some people have a misconception that if you want multiple babies, you should go in. Not true, because it's possible that maybe transferred into you. It's
Yeah.
possible that one survives, two, or even none at all.
Mm.
So that's a big misconception.
Misconception.
And then one of the misconceptions is that when the man concedes that this infertility is basically his fault, so she is the
Mm.
one that needs. But then from research, it has shown that about 40 to 60% of infertility also is allotted to men. Male
Wow.
factor, yeah.
Oh
So in
wow.
as much as we are looking at this, I think people should read more. People should do a little bit more research on these things to know that a lot of these are just misconceptions, except
Mm.
you're actually in the field, except when, which is where the nurses come in actually. Because sometimes this to
To
the
the
doctors,
doctor,
yeah.
yeah.
I've realized over time with practice that um, patients kind of confide more nurses
Mm.
than the doctors when it comes to these widely related misconceptions.
Mm.
Yeah, so I think that
Misconception I'm going about is that IVF babies are true. Difference for from natural conception is just for IVF babies, the fertilization takes place,
mm,
and then it just follows the same process that happens in the body. So
exactly.
IVF babies are healthy, like very healthy. I will say this again, they are healthy babies. Another misconception going on about is women feel okay. No, so I want to have IVF, but I've heard that once I go in for IVF, all my eggs will be used, which is not true.
Actually.
Oh
Which is
wow.
not true. So over time, as a woman undergo IVF, just a little of the follicles are stimulated to produce egg. Now, a woman or a girl child is born with about a million to 2 million egg in her ovary. But
Okay.
before puberty, these eggs naturally declines.
Mm.
So
It's
it's not
actually
it's not really it's not
mm,
really visible. It's not possible because for a limited number of
Eggs that the
eggs that
woman
can
would.
be that can be stimulated.
Mm-mm.
So others will be reserved for subsequent
cycles.
times or
Okay, okay.
cycles.
So yeah, we have Tessie Cherry saying well done, guys. Yeah. And yeah, said well done, guys. Well done to ALPS
Thank
nurses.
you very much.
Okay, yeah, so a lot of
Mm.
misconceptions, and I think one of the misconceptions I've also heard that when they conceive through IVF, they cannot have any spontaneous pregnancy. If, for
Actually.
instance, if the fertility is unexplained or everything fine, but concern, at least I've seen a few people that are
Yeah, yeah, it's
spontaneously.
possible
So
for
I think I've because
spontaneously.
I've heard that I've heard some people say that fertility after IVF has a block tube. I believe that it has to be IVF
Yes, for
Yeah,
because
blood
actually,
tube
yeah.
yes,
because
so it depends.
It
But
depends on what is
if
causing the infertility,
exactly,
actually. Yeah.
so because if everything actually looks fine, it's still possible to conceive even
Mm.
after one IVF if
yes,
all things
um,
look okay.
yes.
Yeah.
So well, that's that for the misconceptions. So now I would want you to give them a little breakdown of this IVF processes. You're having a client, then maybe the doctor has seen, and the doctor the next, most times when the doctor see, they prescribe. The next thing, meet the nurse. I mean, how do you manage this process with them, or how do you let them know, okay, this is the period your injection will take, and what are the things that you do when you're communicating with them? How do you, and then how do you deal with your communication breach? Because it seems like this IVF thing, you will have a lot of communication to do. So
Actually, we do.
maybe you should tell us a little about your experiences with this IVF, how you explain it to your clients, how you prepare them for IVF, and then make them understand the process it involves. Oh yeah, miracle is saying.
A patient have been seen and had evaluation, and this patient needs to be planned, and that's the patient emotional. So it as planned that now some of the process. So now they need to know that the first thing we do in after evaluation is the down regulation. Once down regulation is done, they do stimulation, and stimulation actually takes some period of time. While they're on stimulation, more and the fertilization, embryo transfer, and the waiting time. Now, each patient needs to know, you need to set expectation,
Mm,
because as I've said earlier, the journey is form of
will
this
be.
treatment will be.
Mm,
So you need to set expected goals for her, like she needs to know her chances testing
mm,
with IVF. As we just earlier said, IVF is not 100% guarantee. It only increases the chance for fertility, but it's not 100% guarantee. So this patient needs to know what they are expecting.
mm,
They need to know there could be failure in the process of IVF treatment, and you have to educate pregnancy. They need to know that this is associated with so many risks, like preterm birth. They might need SCBU care
mm.
because these babies are not term. They might need more hospital stay. So what expectations to this?
To know
Yes,
what to
what
expect.
they expect
Oh,
to
oh yes. So we have no, it's,
we see
thank
you
you.
too.
Cool. Maybe she do it from the way she talked. She seems to be like your colleague. She said,
Yeah.
Yes,
"Well done."
actually.
See, you have a lot of your colleague cheering up. And do you have any nursery in your place? Someone seems to be hyping her.
Yes,
She
we
said,
do. We
"Yeah."
do actually. She's our
she
scan
she
nurse. She's
said
actually the IVF
she
coordinator,
said,
right?
Yeah.
For nurses.
"Oh,
Yeah.
okay." So nursery choice. So she has given us a little about for them because you know some verify their IVF. They are planning to come and stay in your home. So what's your counsel to them? How long is the procedure? Do you just permanently come and stay in the hospital and wake up in the hospital and finish everything? I mean, what's your, because these are some of the things I think they
Yeah.
would also want to know. As dear viewers
Yeah,
want
yeah,
to
yeah.
know that will you stay in your hospital till we finish the IVF or not? So what's your
Yeah. I think to add to what she just said, like um dealing with IVF clients of these patients are not where you want them to be emotionally. So it's you need to be patient
No,
with
you
clients.
can.
Yeah. So you have to have the high level this information that they can understand. Now, putting in mind that if IVF, there are series of things, there are series of tests. Now, it's not going to be easy for me to just come lie down every time you're putting a probe, you're scanning me. That has something to emotionally with me too as well. So while you're preparing them, you let them know that there will be a point in time that it comes that we have to do regular scannings, especially for the clients using their own air. Scans on a regular. Then sometimes you could find yourself doing little drainage. It is something you have to put in their minds as well and be like, hey, you might go through this because I am seeing this. So it's not going to be easy to sit and just be pricked. It's also something you need to physically prepare this person. Now, for people that are maybe not using the donor egg, treatment should go within 3 to 4 weeks at most.
oh
Then
okay,
yeah,
okay. So that's what
three to
their
4 weeks. So
expectations.
yeah, so you won't really expect the person to come stay in the hospital for 3 to 4 weeks because of hospital is a place of illness as well. Patients come in and out. The fact that you're not expecting them to come stay in the hospital, there are nosocomial infections that can be passed through from one patient or from maybe patients that if they want to stay
If they
close,
want to
yeah,
stay close.
want to stay close to the facility, you can maybe help them source out for places that they can stay. And you could find a way and maybe arrangement, especially for those that are egg recipients, they wherever they are for a certain period, then you let them know when in order to cut costs too, because in as much as you're trying to help them, you're trying to look at also the emotional and the financial burden that it puts them to. So you arrange it in a way that is also convenient. So carrying them along and then being informed is also another thing. So if they are not properly informed, then they don't make plans. You understand? That is why you find the patient calling you as late as 2 a.m., 1 a.m., asking you, when am I starting? At that point, and then you imagine, okay, this is what this person is
It's
going
going
through.
through.
Some of them actually don't have questions to ask you. They just need
Yes.
somebody to talk to.
Talk to.
And then being their IVF nurse, it is your duty to listen. You understand?
True.
Because they are, at that moment they are under you. And then the more you show interest in their care, the more you show them that you care. It gives them room to open up to you. So the period, then you make preparations for that. But
Okay, so this is me thinking, Noslavin had also mentioned the part for egg retrieval. So do you just tell her, okay, she comes in today, and you just tell her today's they were collecting your husband's sperm, or there's a preparation, you let them know before time? Because and what if, because I'm sure you deal with clients that are not even in Nigeria or are not in Jersey. I mean, how do you manage that? Okay, so I can see Dr. J, maybe you people know how Gianni. You said good job. House nurses are amazing. Oh yes, they are amazing. Joining the show with them.
I think for the oocyte retrieval, that is why I said you carry them along with every process you're going through. Now,
Okay.
usually, when this is available and you're doing simulation and scans, you have communications with her. They have. Yeah, there's a
Okay.
timeline
Oh,
that
so
is
you
usually
prepared them.
there are timelines.
Outline their schedule.
Instructions are being prepared so
Oh,
that
I
it will be
see.
arranged. Hey, between it's a possible date for oocyte retrieval.
Oh, okay.
No, hey, between so date and so date are the days of planning
So they free up
for,
their
so you
schedule.
begin to free up your schedule between that time. And you also let
Okay.
them know some of these husbands need to take permission from their places of work. So you can't just
Yeah.
tell them a day or two and tell them, hey, you need to take permission
And
and
all
it.
that.
And imagine somebody coming all the way from Lagos to come here and you're giving him a day or two. What if he
Notice
doesn't
that's
have money to
really
pay for flight?
concerning.
What time does he have to
Exactly.
make preparations? Yeah. So this timeline gives them a guide. So the moment you start your down regulation, you send these timelines to them. Then you constantly remind them, hey, this is the period your husband will be coming. Hey, this is the period we're
So
doing
it
an egg
prepares their
retrieval. Yeah,
mind.
so you prepare and come.
So this is just letting you know that your life does not have to. You can still go about your life. Everything can still be normal. Yes, activities that are not harmful to you, you can still go about them. You just need to have a good IVF nurse, because they seem to be good IVF nurses. Of course, they won't even allow them to have this show if they're not. They're not. So, if you have this good communication from them, knowing that this is the period so thing is likely to happen, because like one thing I learned is they can't be precise with dates because they are
Yeah.
monitoring you. So they give you a range so you're able to plan. So it makes you know that IVF, to some extent, is not rigid as you think. Yes, it follows some principles, but there's still a form of flexibility such that you are able some things to give you information ahead of time, so you're able to plan up your schedule. So yeah, from what they've explained, I've learned that IVF doesn't place your life on hold.
Yes, it
You should
doesn't.
still be about your life. It just helps you program yourself and the activities that you have to do. So, well, yeah, so we have a question from young Sarah. So, what are the chances of getting pregnant after failed IVF procedure? That by natural, she means be spontaneously or other procedures. So, she's asking, what are the chances of getting pregnant? Some people want to know probably why is she.
Chances of getting spontaneous pregnancy depends on the age of the woman. Now, the age of a woman plays an important the fertility plays an important role. Now, the health of the woman's uterus is another thing that plays an important role in getting pregnant spontaneously, even after the women who are not spontaneous pregnancy because already there's a default in the womb. So the woman um, reserve,
Reserve.
she have a higher chance of getting pregnant spontaneously. And it's also important that the sperm quality is top notch because it plays a key role in fertilization.
For me, I would think maybe trace back your treatment and know why it failed in the first place. You
Since she said
understand?
it's after a
Yeah,
failed
after a
IVF
failed
procedure.
IVF procedure. So I feel it's something you could go back to your healthcare giver and ask, hey, why did I fail? Then that they could begin from there and know, okay, this is why you fail. Okay, it could be egg related, it could be sperm related. Then I feel that gives you a guide to where you would direct. So it is possible actually to get pregnant naturally. That is, if those things that made you fail the first time are something they can like look into.
Okay, so I really hope that your question has been addressed. But then I know that I had a live session recently with Dr. Deborah. She had said that your chances. We're not saying you should keep failing before you succeed.
Okay.
So that's not what we are saying. But all we are saying is that the fact that you had a failed IVF doesn't mean you cannot still have a successful IVF. And yes, you still have a high chance, provided something different or something new is coming into the treatment. And that's why, like Nurse Rejoice has said, you would have to retrace your step. That's more like saying they will have to do a review of your treatment to know if something was wrong. And if something was wrong, probably maybe you made the wrong choice, or maybe one specimen they feel maybe you should use a donor sperm or something. There must just have been something that they might be able to pick for why the IVF might have failed, and there might be a new option or there might be a new suggestion, which if you likely pick, you might be able to. I've heard a lot of people that have failed IVF and they succeeded. I know I've done IVF up to 4 times and it failed once she succeeded. So it means that it could actually succeed. Yes, you have a high chance of actually succeeding if the right thing you've done is done and if you make the right decision, I believe. So for the clients or for our viewer that asked this question, you could, well, we don't know what it is exactly, but I believe that if you've had this that you've had, if you want to try something new, yes, you could talk to us at Alps Hospitals with the number being displayed at the screen. But if you don't want to try something new, you could have a review with where you had your treatment done, and I believe they would be able to give you reasons and try something new. And we hope that you succeed. So sorry about the IVF that might have failed. But we hope that you succeed. Just whichever way you try to go, either spontaneous if everything seems okay, and if it's assisted reproduction technology, you decide to. No. Okay, so we have Jane this is saying outsources. This is having a good time with them. Okay, so I was going to ask, you've had to counsel a client and your counsel was a game changer for that client. Maybe he or she had seen the doctor, and by the time they saw the doctor, maybe they were, for instance, maybe a 45-year-old was insisting on using her eggs after seeing the doctor. Maybe the doctor told you, you've done all the counseling, you say she wants to use her egg. At that time, you've had to deal with clients like that, and somehow you were able to talk to them and make them understand, and there was a game changer for them, and they succeeded.
Yes, absolutely. To
Oh,
the to the people
okay.
you've convinced. Like I said earlier, there are times that these patients would not be free to talk to these doctors. Like I found them being confident with nurses. Like
Okay.
basically sometimes you find them saying sometimes they share an information with you and then when you go back to the doctor, hey, she said this and it's like, oh, but she didn't mention. You understand? I find that there's this level of trust they
Oh.
have with nurses. Yeah. So when they come and they'll be like, hey, I've had a Hausa woman, and then she's like, "Hey, I don't want to use a donor egg. I
Okay.
want to use my eggs." And then I think she's near 50. And
Oh,
yeah, she's
wow.
near 50. And I told her, how do you think that would be possible? What was your conversation with the doctor? So she said, yeah, he told her that it's her chances would be quite telling you the truth. So we had series of conversations, and then you would understand her fear. You would understand she feels, oh, this is not my egg. I'm not going to treat it at least not like my baby. You have to really understand and you're like, hey, if you really want to succeed at this, then you have to go this way. But if you insist, then there's no way you can force a decision on a
Yeah.
client. That is why in nursing generally, you educate your client, allow them make informed choices. You understand? So by the time we had conversations we had,
Yeah.
she didn't even make the decision that day.
Okay.
Go back, then we made series phone calls,
Tours
and
and
then she
all.
would come and be like, hey, I don't think I want to do this. I'll take your time, read about it. It's not really a bad thing. She would still call me other times and be like, okay, I'm still in between about this decision. We went a little back and forth, and then she finally agreed. She was like, hey, I really feel okay, I can do this. You understand? And then she did.
Oh,
You
wow.
understand? Yeah, a couple of them like that. So I think
Wow.
yeah, it's something you do always.
So you see why you need a nurse in your life. Please get yourself a nurse.
Yeah.
Oh yeah. So do you have something you can
She as mentioned, education or counseling plays an important role
so that's more like a major
to,
thing for a nurse.
yes, for
Yes,
a
it
nurse
is.
to do, because without counseling this patient, she wouldn't be convinced that there's a need for her to go in for the donor egg. Um, in giving this patient counseling, you need to give them a supportive option, which is the option of using a donor egg. Now, a woman at age 40 wants to use her egg. The chances for her success rate is just about 10 to 20%. And with these chances, they are more likely to have chromosomal abnormalities.
Abnormalities. Wow.
Somehow they might get pregnant, but this
Mm.
pregnancy in miscarriage,
Miscarriage. Oh,
there's
wow.
abnormality that happen. But
Mm.
with a donor egg, the chances is high.
Hey,
Some of them, when you give them the option, they will say, okay, I want to use my own egg together with
The
that of a
donor.
donor egg.
Mm.
Some will say, oh, I did not understand that the chances with my own egg
actually,
is
yeah.
so slim. I do
Mm-mm.
not understand that even if I get pregnant with my own egg, um it could be terminated or it could lead to miscarriage. So with that, with the information you offer them about using a donor egg, because the donors are young girls and they have good quality eggs. They have the quality and the quantity of their eggs. The quality of egg influences implantation fertilization.
Mm.
So these informations help them to make an informed choice.
Okay, so we have my saying, great guys, you guys are doing well. Okay, yes, so Nurse Loveling has also given us her experience over time. So yes, the fact that yeah, I'm sure there must be someone that young that is watching and she might be saying, okay, I tried IVF and they said the quality of my also possible to be young and have
Yes.
Yes, it is. It is
eggs
possible.
that the quality are actually poor.
Mm.
So that's why yes, it's good that you know all this, that you can be young and still have very poor egg. You
Very
can be
poor
young and
quality.
still not have egg. Just have the proper evaluation done, have the good counsel, have a nurse by your side and a good fertility nurse like them by your side, so you're able to navigate and make the right choice that would actually increase your chance of success, because it doesn't guarantee 100%. Yes, you all know egg or donor sperm, it still doesn't guarantee that it's going to succeed. It's just that it increases your chances of success. Yeah, one though is saying wonderful nurses.
Oh,
Oh yeah, I
thank
must say
you.
they are wonderful. So yes, our time is fast spent. If we say we want to continue on IVF, I'm sure it's never going to
It's
end.
never gonna end.
But
Yeah.
yeah, just you also chat up the number being displayed on the screen via a private chat on WhatsApp, and all your concerns will be attended to. It's actually been good having you, our dear viewers. Stay tuned. And yes, I must say it was good to have you this time with you guys.
Yeah,
Thank you for coming in.
thank you.
And thank you, dear viewers, once again for staying tuned. On behalf of Alps Hospital, we say thank you. Have a lovely evening and see you next time. Bye.
Thank
Thank
you.
you.
See you.